So today we're going to try and understand cancer, just in general terms, so you can have a good idea of what it is and what to look out for. In order to understand cancer, we have to understand how the body works on a cellular level. Let's talk about cells. Cells are the smallest part of your body. Well, not the smallest part, but the smallest individual part. Every cell has a nucleus, and in that nucleus is all your body's DNA. The only cell that doesn't have a nucleus is the red blood cell. So understanding cancer is about understanding cells and the DNA that's inside them. The reality is all of your cells are always trying to divide, all the time. They're constantly trying to divide. Without us controlling them, we would be giant blobs sitting there, huge masses of cells with no consequential behavior or structure or anything. We'd be a giant mess. And the reason for that is because we don't want to keep growing forever. So what we have is special genes called tumor suppressor genes. And these genes are responsible for preventing cells from growing. They're constantly turning off the system that by default will be on with all the fire hoses blasting, make new cells, make new cells. These genes are responsible for turning off cells. And turning off cells and intentionally even killing cells when you're developing is a key part of becoming who we are. And it's a key part of remaining cancer-free. So cancer is when we have a mistake. Usually it's a mistake in one of these genes that are tumor suppressor genes. It's one of these genes that is responsible for shutting down this need to make new babies, make new cells. And when this gene goes wrong or gets broken or is disrupted, well, then what happens is that cell starts growing like crazy. And as those cells grow, they form a mass called a tumor. And that tumor can be benign. Benign means it's not life-threatening. It's not going to jump around your body and spread everywhere and cause death. But sometimes benign tumors can cause problems because they grow into important parts of vital organs and they have to be removed. The classic example of a benign tumor is brain tumors. There are some benign brain tumors that can be very life-threatening because they're pressing on important parts of the brain. Okay, let's talk about when cells metastasize. When you hear about metastatic cancer, what that means is you had that original tumor and then one of those cells flicked off, usually into the bloodstream, floated to another part of the body and then started growing there too. Now you have two tumors, and maybe it happens lots of times and you become filled with tumors. This commonly happens to bone, it commonly happens to the liver, it commonly happens to the lung or the brain. You get these little metastases, or what doctors call mets, that are growing all over the body. In cases like this, your targeted approach towards the cancer may be to inhibit cells that are growing as opposed to cells in a particular area. When a cancer is still in a particular area, a key form of treatment is surgery. We're going to try and chop that thing out before it spreads. Now, sometimes when you chop that thing out, especially in breast cancer, they may do some focal therapy around that area just in case they didn't get to that mass in time. A focal therapy might be radiation. The way radiation works is these X-rays disrupt cells that are trying to divide. They screw up the dividing process. Since we know that cancer cells are cells that are growing out of control, those are exactly the cells that get in trouble from radiation. And so we're preferentially killing cancer cells over cells in our body. The sad thing is that with radiation, it's not so perfect. And some of your cells are dividing. In fact, there's some tissues in your body that are dividing all the time. Examples are skin cells, gut cells. These cells are constantly dividing, so they can get in trouble too. Depending on where the X-ray is aimed, may determine some of the side effects of the symptoms. Classic symptoms include nausea, especially if something in the GI tract is targeted, but oftentimes we can get burns on the skin from the radiation and discomfort on the skin. but generally radiation is reasonably well tolerated. Another thing we can do that is helpful in killing cancers is medications, and we generally classify those medications as chemotherapy. Chemotherapy is obviously the mainstay of cancer therapy. The way it works is these are a group of medicines that have different techniques of reducing cells' ability to make copies of themselves. Once again, you're targeting the cells that are just in that cancer that are constantly making copies of themselves. Those are the ones you're trying to kill. So examples would be medicines that act like a piece of RNA or DNA that gets stuck in the mechanism so it can't divide properly. Things like that. The thing is, like we said, some of your own cells are trying to divide at the time. And so as a result, chemotherapy has a lot of side effects. Frequently, people feel exhausted, like a train hit them. They'll feel nauseated. Sometimes that's the gut, because the gut is making so many new cells, the gut can be affected. Sometimes it's very specific problems, like there's one chemotherapeutic agent that causes a very bloody bladder. Now, that's a very specific thing, and so some of them have specific side effects. Almost all of them will affect your ability to make bone marrow. Now, bone marrow is responsible for making white blood cells, red blood cells, and platelets. The cells are responsible for fighting off infections, clotting your blood, and delivering the oxygen to your whole body. And those cells, when they're sick or disrupted, those counts can get low. And patients can be at risk for bleeding, they can be at risk for infections, or they can need blood transfusions to keep the oxygen delivered to their body. So these are all potential side effects of chemotherapy. And oftentimes, doctors will employ a mix of these three general treatment modalities to take care of your cancer. Now, I'm only scraping the surface because the reality is so much is changing so fast in terms of cancer therapy. We're really making remarkable headway in treating cancer. Let me give you a specific example. When I was a medical student, I took care of a man who was dying of metastatic melanoma. Melanoma is that really dark colored skin lesion you can get as a result of exposure to the sun. It's a skin cancer. And back then, the mortality of melanoma was incredibly high. I don't remember what it was. It was about 90% fatality in 5 years. So I left medical school and I went into pediatrics, which, we don't see a whole lot of melanoma in kids. And so I sort of forgot about this for a while. And then I was reading fairly recently, it turns out now melanoma is not a big deal at all. And this is because there's yet another class of chemotherapy agents, which we can call immunologics, which are antibodies directed at certain proteins in our body. And it turns out because of these new immunologics, malignant melanoma has a great prognosis, way better than it used to. And these kind of advances are super exciting, and we're really right on the precipice of discovering some really exciting therapies for cancer, and are discovering them every day. So what are the major kinds of cancer? Let's go through them. The most common kind of cancer is skin cancer. That's probably because the skin is always dividing, so there's opportunity for mistakes to be made, so you can be more likely to get a cancer cell, and because our skin is huge. It's the biggest organ, it covers our entire body. So there's lots of opportunity for mistakes to be had. Also, we tend to not be very good in terms of our skin care. What does that mean? That doesn't mean moisturizer, that means sun exposure. And we're all pretty bad at that. The reality is, suntan lotion can be profoundly beneficial at preventing skin cancer. Now, here's the thing though, skin cancer isn't the most fatal disease because we usually see it when it shows up. We look in the mirror and we say, because usually areas where there's sun, you look at your face, you look at your nose, say, hey, what's that thing? And you go get it checked out. So the key thing is if you have a skin lesion that you're not comfortable with, go see a dermatologist and get yourself checked out. You can prevent yourself getting particularly ill. Let me tell a personal story just so you get this idea. A couple of years ago, I noticed a red spot on my nose. Now, I have a history of a lot of sun exposure in my life, and so I was aware, I got to worry about that. I thought maybe it was a zit. It didn't get better the way I would expect a zit to. It persisted, and then it went away, then it came back, and I said, that's odd. And I went to a dermatologist, and he said, that's a precancerous lesion. It's called an actinic keratosis. And I can treat that with a cream, and you'll be just fine. And I did that, and my lesion is gone. If I had waited and blown this off, if I hadn't gone to a doctor, what would have happened is that would have turned into a cancer. And then I would have needed something called a Mohs surgery. That would have left a big scar on my nose. Now, my mortality still would be quite low. It would still probably be a survivable cancer, but I would be disfigured as a result of not having treated it sooner. So seeing a doctor early for skin lesions is incredibly important. Let's talk about some of the other common causes of cancer. Well, the most fatal one in terms of across the United States population is probably lung cancer. And a lot of that is because of smoking. Smokers have a far higher risk of lung cancer than other types of people who don't smoke, although occasionally it can happen in non-smokers too. Keep in mind, you may say, well, what about vaping? I vape, I don't smoke. Keep in mind that vapors are much more likely to start smoking, especially when their funds dry up. So all those kids out there who are vaping in high school, when their parents aren't paying for their vapes anymore or aren't giving them an allowance, they often switch to smoking, and that's when the risk starts. Nicotine has all kinds of health problems, and that's in vaping too. So vaping is not safe at all. Another type of cancer that's out there that you have to think about is liver cancer. Liver cancer is really strongly associated with infections like hepatitis and also alcohol exposure. Of course, there's more. There's also liquid cancers. The liquid cancers, I'm loosely describing as that, are lymphomas and leukemias. Now, those you think of as sort of similar. The way I think of it is when 80% of the cells are in lymph nodes, it's usually lymphoma. When 80% of the cells that are bad are in the bone marrow, it's leukemia. They're fairly similar, they're treated similarly, and they're sort of cousin cancers. Slight differences between how we go at them, but we generally think of them as similar things. And the prognosis for those has gotten better every year. Another big one is colon cancer. Colon cancer is very preventable because it tends to be slower growing. Certainly if you find yourself pooping blood, go get yourself checked out. But it can be subtle, and so a lot of doctors recommend screening for colon cancer. When I turned 50, I decided to go see a doctor, and I knew that I was going to need an endoscopy. That was going to be horrible. I was taking meds and have to poop a lot, and then I was going to not be able to eat anything, and I was going to go to the operating room, and they're going to stick something horrible where it doesn't want thing to have sticked, and then it's going to happen. And I went, oh no, that's going to be terrible. And I went to my doctor, he's like, oh no, we have a new thing. It's called Cologuard. You poop in a cup and we send it for a test. And I didn't even have to touch my poop. It was like this automatic pooper scooper thing. Mailed it off. I'm good for 2 years. So colon cancer screening is not the pain in the butt, literally, that it's always been. And so for some people, you might be able to get away with that, which is really convenient. And I'm so glad I got screened because I know my risk for colon cancer is very low right now. I'm sitting easy and resting pretty. Now, another one that you have to think about is the gender-related cancers. For women, it's breast and ovarian, and for men, it's prostate. Breast cancer is incredibly common in women. It's one of the top cancers and one of the top leading causes of death in women. So breast cancer is a real big problem, and women should get regularly checked and screened for breast cancer. Ovarian cancer is a horrible one. Fortunately, it's very rare, but it's often picked up late. So if you suspect anything funny on your periods or pain in your abdomen, you should go get yourself checked out. For men, the big issue is the prostate. The prostate is a really unfortunate organ. It's down there. You know where it is. It's responsible for helping to make sperm. But unfortunately, the urethra, or the tube that you pee out, the tube that goes out to your penis, goes right through the middle of it. So if it starts to swell, your tube can start to close off and it gets harder and harder to urinate. Frequently, men with prostate cancer will present with difficulty peeing. Now, most prostate cancer is fine. It's 98% survivable. Some people, it can be really bad and really aggressive, but for most people, it's fine. In fact, it's common in the majority of 80-year-olds. In fact, if you look at people who have died of car accidents and things like that, in people over 80, it's extremely common to accidentally see a very slow-growing prostate cancer in it. But getting to that early is key, and seeing a urologist early if you think you have symptoms is important in terms of getting screened. So go see your primary care doctor and get referred when you need to screen for colon and prostate and breast cancer. What I guess I'm getting to, and the heart of this message is, you gotta see your doctor and you gotta live a lifestyle that prevents you from getting cancer in the first place. What is that lifestyle? We're talking about smoking cessation. We're talking about exercise. We're talking about avoiding obesity. Obesity is a huge risk factor for colon cancer. And we're talking about generally living a toxin-free environment. I recommend getting a health coach. They can often help you with these thoughts and these decisions and lead you to a positive outcome. Thanks for your time, and that's my bit on cancer. Have a good day.